to call this the voice of diabetes in Wales, and to a certain extent, we feel that patients ought to be the voice of diabetes in Wales. So we're not just hearing from the clinicians and from the health board structures and things like that, but we're hearing from real patients. And lived experience with diabetes is so important going forward. I want to ask you a question. What would patient involvement look like if it's going to affect our diabetes services? What would it look like? What is your ideal for how patients can be involved in? We've heard talk of how patients are the center of it, but how would you structure it that patients can actually have a voice? I'm going to leave that question. I'll return to it in the end, because I think that's an important question that we need to answer. So, what is the Welsh Government doing? Well, the Welsh Government came out in June 2023 with a diabetes quality statement from the Welsh Government. And if you look at this highlighted area in the middle, co-production of care ensures people living with diabetes achieve the outcomes that matter to them, including individualized timing and content of reviews. Statement from the Welsh Assembly Government. I don't want to go into it. I've explained this really. That's that point 20 there. The co-production of care ensures people living with diabetes achieve the outcomes that matter to them, including individualized timing and content of reviews, empowerment support and treatment targets and care planning. So right at the very heart of Welsh Government is their intention to include patients. So let's hear your voice, and let's hear the voice of people. So how can people with diabetes be involved? Now, we've been working with the patient reference groups over the last 6 years, and the substantial work that we've actually done there. We've worked with dietetics. We've looked at helping them to achieve some of the stuff that Kath has actually presented. We've worked with psychology as well. It's great to see that psychology now is starting to come into some of our services with patients, because I don't have a very good relationship with food. I've got diabetes. I've had it for 20 years. I'm on insulin now, but really the fact is that I've got no complications. I keep myself really fit and manage my diabetes well. So, but psychology is so important to have in there. So we've worked with people with eating disorders. We've produced an annual report. If you'd like to see a copy of that, I'll put that in the chat for you. We've worked on pathways within the health board as well. And we've worked on infographics, putting those together. And the voice of the patient has been really so important. So let's move on. So we co-production of pathways and guidelines. And what the question is, what care are you going to receive from your health board? You need to know this. We need to know what care they are going to deliver to you. So now, Sarah also brought up the fact that language really does matter, and in diabetes it matters. And the impact of negative language, I know what that feels like. You know, I have a response, my strap line with, look, I'm not overweight, I'm not lazy, but I still got diabetes. You know, I work hard, I work exceptionally hard in keeping control. So negative language with people with diabetes is such a big impact on them. And we have not got that in Wales at the moment. So that's one thing I would like to see, is that language matters, that it's adopted into the health service policies. Lobbying for services. We need to be lobbying for the fact that that people are not necessarily getting their kidney function tested, that Sarah highlighted. So we're critical. We do make complaints, and this is the way that change happens. So we've got to have, but we are supportive in that criticism, and we are supportive in our complaints, so that we are looking at to work collaboratively with clinicians, and to work so that we do understand their difficulties and they understand ours. We also want government involvement as well, and I'm pleased to say that there are the cross-party talks on diabetes, which have influenced substantially what Welsh Government policy is. So engaging people with diabetes and living with diabetes, we're looking at type 2 today, and the thing about type 2 diabetes, there are a lot of comorbidities. You know, we have a lot of other diseases as well. We need to be able to be aware of the carers that are involved with people, and the family support, partners, parents, especially with type 1. So patients need to be able to signpost people to the right services, and we as health professionals need to be able to support and give advocacy of signposting people to the right services. Now, I'm going to throw one here that might just, we're not there yet. I think there's a massive role for pharmacists in the future. Not only just in signposting and education, but in perhaps delivering clinical services as well. So that's something I would like to see on the horizon, that pharmacy does get involved. That might be a few hurdles to get over, but let's think about that one. We need lifestyle interventions, as we've seen with the prevention program, and we've seen with the remission program as well. Lifestyle interventions are important. Now, one of the biggest impacts on my life was the fact that I went on an expert course run by the dietitians. Now, that changed my thinking about food, it changed my thinking about carbohydrate, and it helped me get control of my diabetes and not take so much medication. I must say, I take a shed load of medication, but my diabetes might be slightly different than most other people's, but it's something that I actually live with. The deprivation and our social concerns. We're looking at deprived areas of Wales that have low social income, and perhaps also ethnic areas that we need to be able to have a voice into. We would like to hear from patients that are in those communities, and we are working and will be working quite strongly in those areas as well. Education is important. Literacy is important in Wales. And also digital exclusion. Not everybody can come on a Zoom call. Not everybody can do that. And a lot of people still rely on groups and paper and that sort of media rather than the social media. So again, finally on that one, language, I'm going to come back to this. Language does matter. One of the comments that we had, it's about patient activation. I'm not quite sure about patient activation. I'm not a robot. I'm a person living with diabetes. And I don't want to be activated, but I want to be engaged and involved. Yeah, okay, let's move on. So how are we going to structure our engagement? We need people on health boards. We need people in the services groups. And in this new forum for diabetes that Sue talked about, the Diabetes Network, we need people to be able to let the health professionals know what our issue is. We need to have lived experience for people with diabetes. It's vital and it cannot be replaced. I get involved with local groups, peer support groups. I run a Cardiff group, the Cardiff Diabetes UK group, and we're celebrating our 70th year coming up, which is a great achievement for us. So local groups offer peer support and talking to patients that have the disease, have the condition, and so vital. And in this age also, we have online groups, called WhatsApp groups and things like that. And they're so very, very, very important. And for people who can engage, yes, we can do that. Right, let's move on again. Hang on. Oops, sorry, I've lost that. Oh, finally, I want to come back to that question again. Sorry, I've stopped sharing. I want to come back to that question again. What does good patient engagement look like to you for diabetes services? Thank you very much, Claire. Thank you.